Today we're looking at the diagnosis of Avoidant Restrictive Food Intake Disorder, or ARFID. This is a diagnosis in the category of feeding and eating disorders in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition text revision, or DSM-5-TR for short. In this video, we're going to cover what ARFID is, the diagnostic criteria for this diagnosis, as well as other relevant information about ARFID. But first, my name is Keegan. I have a master's degree in counseling and I'm a licensed professional counselor. I make videos like this to help you better understand counseling, psychology, and the world of mental health. Previously, ARFID was referred to as feeding disorder of infancy or early childhood. However, the name was updated to Avoidant Restrictive Food Intake Disorder, and this diagnosis now includes adolescents and adults as well. ARFID is a diagnosis that, as the name suggests, centers around the avoidance or the restriction of food. This might be because of a negative experience with food, such as choking, or it may be linked more to the sensory aspects of food or eating. If the person with ARFID is primarily struggling with the texture of food or the sensory aspects of eating, the diagnosis is more likely to appear in infancy or within the first decade of life. When this is the case, it's likely that the diagnosis will persist into adulthood. If there is a negative experience with food that was the trigger of ARFID, this can develop at any point in life. Many people with ARFID may be referred to as a picky eater, but really the diagnosis is much more than this. People with ARFID can experience food avoidance or restriction to the point that they need supplemental nutrition, such as through a feeding tube. It's also common for people with ARFID to experience weight loss or to not be able to gain weight at a rate that would be expected for their age, such as children or adolescents. If you're aware of the DSM, you know that some of the diagnostic criteria can get quite lengthy and in-depth. However, with ARFID, the diagnostic criteria are actually a bit more straightforward and concise. And so as we get into the diagnostic criteria, the first piece is, of course, that the person with ARFID is going to have a disturbance in their feeding or eating. And this is going to be characterized by a lack of interest in food, aversion to food because of the sensory aspects of it, or worry about the consequences of eating. Next in the diagnostic criteria is that the person with ARFID must meet at least one of the following 4 criteria. First would be experiencing significant weight loss or not being able to gain weight at the rate that would be expected for their age. Second would be experiencing nutritional deficiencies that are considered significant in some way. Third would be if they're having to rely on supplemental nutrition, such as through a feeding tube. And fourth would be a disturbance in their social functioning because of their eating symptoms. Keep in mind that this must be occurring in a setting where the person has access to food. If they don't have access to adequate nutrition for some reason, ARFID would then not be an appropriate diagnosis. Also, if the person meets diagnostic criteria for anorexia or bulimia, ARFID should not be diagnosed. Similarly, the person should not be avoiding food intake or restricting their intake of food due to concerns about weight or body image. And finally, of course, if these symptoms can be better explained by a medical or another mental health diagnosis, ARFID should not be diagnosed. That is the diagnostic criteria for ARFID. You might be wondering who's most at risk for ARFID, which we'll discuss next. But first, if you're enjoying this video and finding it helpful, please help me out by giving it a like and subscribing. Now let's discuss the risk factors for ARFID. As we do, keep in mind that these are not the causes of ARFID. These are simply just things that increase the risk that a person may have or develop ARFID at some point. The first risk factor relates to other mental health diagnoses. If the person has an anxiety disorder, obsessive compulsive disorder, attention deficit hyperactivity disorder, or autism spectrum disorder, they may be at increased risk for developing ARFID. Second, for those who are raised in a more anxious family, this may also increase their risk for ARFID. A third risk factor is if the person's mother has an eating disorder or has had an eating disorder, this would also be seen as another risk factor. Finally, certain medical conditions, specifically those that interfere with eating, may increase risk. This includes things such as reflux or other experiences that a person might have, such as vomiting. That's an introduction to Avoidant Restrictive Food Intake Disorder. I hope that you found this video helpful. Let me know in the comments if there's any other questions that you might have about ARFID. While you're here, make sure that you check out some of the other videos on my channel. Thank you so much for watching, and I'll see you in the next video.